Hey, hi everybody. Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic, and we're here for another live video presentation on another I think, a very important medical area to cover, and that is weather changes and how it affects each individual, whether you have fibromyalgia or any health condition whatsoever. You're going to find that you need to know some information concerning this so that you can be up to date. You know, we take for granted weather changes, and yet weather has a very important control over how we feel many times, especially as we mature, or if we have any health problems itself. Look, if you have an inflammatory condition, weather changes most often will have some effect on you. But there's some other things that you should be involved with, because as we come across seasons now, especially during the fall, a lot of people start to travel. They start to go different locations and areas and so forth. And these will adversely affect you also. Think about it. How many of you have gone on a trip and not really considered the air you breathe, the water you drink, the food you eat, maybe dietary changes? Now that you're out of town, you let that dietary aspect kind of let go a little bit, you know, and you just say, I think I'm going to enjoy myself a little bit. And then all of a sudden, you have some additional aches and pains, maybe intestinal problems, maybe irregularity as far as bowel movement is concerned. So you have to take that in consideration. Not only the temperature changes in the locations that you're at, and you should really look those up before you go, but also, again, the air differences from one area of the country to another, or just one area of your state to another, okay? In Arizona, for example, you know, we're talking about desert locations. If you're in the Phoenix metropolitan or Tucson area, you go up to Flagstaff, that's a mile high, and the air there will be a lot different. And so if you have a chance to go to an area that is much higher as far as elevation, make sure you give yourself extra time, because you're going to find out that you might be a lot more tired. Again, the water will definitely be different from one location to another. A lot of people say water is water. No, it's not. It's how those cities or how those states actually take care of the water. And you probably have heard some horror stories about Michigan and how they don't take care of their water oftentimes. So that's why sometimes bottled water, even though it might be more expensive, might be worthwhile. I remember a lot of traveling that we did in Mexico years ago. We always had to buy our own water, of course. We never were dependent upon the water from Mexico out of the faucets. That has changed quite a bit because of the tourism and so forth. So that's one thing. But let's take a look at some other things. You know, years ago, we're talking maybe 20 years or more, the Midwest did studies on temperature changes and how it affected an individual's body. And if you have medical conditions that, especially involving the joints, or fibromyalgia, that even though it's not a joint condition, but it does affect the joints because you're achy sore all over. You really have to know about these things so that if you travel somewhere, you're going to gird yourself or take care of yourself before other things happen. Of course, one of the most important things seasonal-wise is temperature. They might have 20, 30 degree temperature variance overnight. Or the difference from daylight temperature to the evening temperature might be pretty dramatic. And so that's one of the things that you really have to consider and evaluate when you go someplace. Make sure you check the weather ahead of time and make sure that you have proper clothing and so forth for that time. Barometric pressure changes, you know, whether or not there might be storms or not, so forth and so on. I'll bet each and every one of you can probably pinpoint a time you said, well, I can't believe how my hands are achy, sore, stiff, or all of a sudden you get up in the morning and it's like, what happened? I can't believe the differences as far as how I feel. Well, barometric pressure changes, again, are one of the major things that you could look into or should look into as far as some of the weather changes in effect and how it affects you. Humidity, well, that's a big one, isn't it? Boy, I'll tell you, especially if storms are coming, a lot of people have adverse effects with humidity changes in itself. Arizona, again, I have to use that as an example, is very dry. But when I travel to other areas that may have more temperate temperatures and might be a lot more, say, humid, especially in and around the oceans and so forth. Well, you really have some problems there. It takes your body maybe 3, 4, 5, maybe a week, 3, 4, 5 days or a week for yourself to acclimate itself to these temperature changes. Now, just to look back in time, this is number 85 live video, and I've saved each and every one of these. And now, Fibromyalgia Wellness Center is on YouTube. Each and every one of these are on YouTube. But number 26, that was over 50 weeks ago. Actually, if you look at it, over 60, because I did take a few days off because of travel or whatever else. So over a year ago, I talked about weather changes. And so what I've done is you have seasonal changes. As a matter of fact, that's the reason why I'm going into this, is because the seasonal changes are upon us. Look at Montana, got hit with a big snowstorm after having a fantastic temperature. And interesting, on the East Coast, they're having 90-degree temperature. They should be really in the 60s or 70s at this time. So it's going up and down, and that adversely affects your body and how you're going to be able to not only work, but also just live day to day. So again, temperature changes, barometric changes, humidity, very, very important. Again, to evaluate and check precipitation. With humidity, of course, oftentimes you have rain, okay? And that wet weather, oh my goodness, for many people, if you have an osteoarthritic condition, rheumatoid, or many other inflammatory conditions, this will adversely affect your body's ability to deal with those things. So it's not only the weather changes in your area, but also if you're going to be doing some traveling. Again, look up, take a look and see what to expect. It's very, very important. I always said that Arizona is probably one of the best places to have bad conditions because we only really have 2 seasons, extremely hot and temperate. We may have a couple of days in which it'll rain, not that much, and also we'll have a few days in which it get cold. As far as the dramatic temperature changes, we really don't have that much in Arizona. The Phoenix metropolitan and Tucson area, Flagstaff is 4 seasons. So within 2 hours, you could go from actually having no change to a dramatic change as far as how it affects you. And again, when you're having precipitation or rain, that adversely will affect you oftentimes in the joints and other areas of your body. You know, these things don't also take in consideration. Don't forget, if you have headaches, you know, these things like temperature changes and barometric pressure changes, especially humidity, rainfall, so forth, those will bring on headaches or dramatically affect your headaches or bring on new ones in effect in itself. And something maybe you haven't taken into consideration, wind. Okay, yes, it's very, very interesting, especially if you live on the coast. You'll find that right around 4:30, 5 o'clock, you get those ocean breezes, okay? And that wind will and could adversely affect how you feel. Or just in the Midwest, I remember I'm originally from Illinois, and boy, I'll tell you, those winds would really whip up and literally almost knock you off your feet. And so you have to take into consideration wind and how it adversely affects you. Boy, it sounds like I'm just killing you with all these things. But it's things to take into consideration, especially if you're, again, going to be traveling, going on vacations, going on the holiday vacations, so to speak, to different areas. Make sure you give yourself enough time to adjust to the temperature changes or barometric or wind or rain or whatever else, so forth and so on. So what are you going to do for yourself? Well, your body has an acclimation type of a leveling. You're acclimated to where you live, okay? Especially if you've been there for a couple of months, you maybe have moved and so forth. And again, if you've moved locations from one area to another, again, you're dealing with the same things, the air you breathe, the water you drink, the food you eat, so forth and so on. There's going to be an adjustment period. Don't be surprised. Don't be surprised if your animals have a difficult time adjusting also. I know that I'm going to throw that out, but I've seen that quite often working with animals, how they are adversely affected from one area of the country to another if you're going to be moving. So again, what are you going to do with these things? Well, are some things you can very easily do. And that is stay active comfortably, okay? And that means what you want to do is you want to start stretching a little bit, slow stretch and hold, nothing too dramatic, depending upon age and what you can and cannot do. If you're bedridden, you can still do some stretching. You can pick your arms and legs up and so forth. That's very important. Or say if you're in a wheelchair or whatever, you can still do these stretches, okay? Look, you can just kind of tilt your head from side to side and turn your head side to side, shrug your shoulders, move your arms. All these things are really, really important. You're oiling the joints. You're oiling your joints. Hey, don't forget fingers, okay? You know, I used to always play this game like this, you know, just going back and forth, and nice light stretches, move your fingers like this, so forth and so on. Nice gentle pulls, nice gentle, you're not yanking them off and so forth. Open the joints up, allow fluid to get in between the joints, extremely important. Slow stretch and hold, extremely important. How often do you do it? Well, I do it in the morning. I do it at midday if you start feeling uncomfortable. And then I do a little bit at night also, okay? Get those joints, get that fluid in between them. It's really important. Diet, watch your diet, okay? If you're eating a lot of inflammatory foods, as I mentioned, you go on vacation or something, all of a sudden, hey, let yourself go a little bit and so forth. You know, watch the sugar, gluten, trans fatty acids, and dairy. You know those foods by now that adversely affect you, so don't eat them, all right? That's very, very important for you to understand. Fluids, make sure you keep well hydrated. Make sure you drink a lot of fluid and stay hydrated. You don't want to get yourself low in fluids in the body. You should be drinking fluids before you get thirsty, as they say, okay? Another thing, check your meds. If you're taking medications, which many of you I'm sure do, check the side effects. If the side effects include, you know, stiffness, soreness, low back pain, so forth and so on, if you're going to go to different areas, they may be worse than normal for you, okay? And so don't be surprised about that. But check the meds and make sure you know what the side effects are and how they may adversely affect you as you're traveling, going through seasonal changes, all these wonderful things that you're going to do, okay? And the other thing is get a little extra rest in, okay? Now that you've exercised, so forth and so on, get that little extra rest in. It's, you know, it's okay to get that midday nap if you want to, whatever. It's not going to adversely affect you. Matter of fact, it'll probably make you feel better, okay? Get in good positions. Try not to sit or stand or whatever else positions that might adversely affect you. Those are all very, very important because weather changes whether or not you're traveling or not, whether or not you're going to go on vacation somewhere, or whether or not you're just going to be home. Weather oftentimes adversely affects those people that have already an inflammatory condition. What's an inflammatory condition? Anything you have pain about. If you have pain in your back, if you have pain in your knees, you have pain in your ankles, you know, stiffness, soreness, achiness in the hands and so forth, the neck, whatever it might be, headaches, all those things are inflammatory. And you can control those by, number one, recognizing, of course, seasonal changes, weather, as I just mentioned about it, and also no dramatic changes as far as your diet, the air you breathe, the water you drink, so forth and so on. Make sure you know, be knowledgeable about what you are taking, what you're consuming, and also your activities itself. You know, if you're going to go on some kind of vacation, whatever else, try to stay active comfortably, I always say. You know, try not to overdo it. If you're going to be at home, again, stay active comfortably, all right? As we mature, you're going to find out you're going to have a few more aches and pains and so forth. Don't let weather or seasonal changes adversely affect you too much by not knowing about the things that we're actually giving you as far as information. Again, stay active, slow stretch and hold, move your joints and so forth and so on. Make sure you stay on a proper diet, drink proper fluids, check your meds, get enough rest. All those things are extremely important for you, for everybody, and for the people around you. That's just as important. So, the studies that have been done already have shown that barometric or seasonal changes, barometric, whether it be or temperature or wind or rain or humidity, so forth and so on, precipitation, all those things can adversely affect you. Just being recognizing and be cognizant of how they may adversely affect you doesn't mean that you're having new conditions. It just means that you're going through these seasonal changes. Now, if you are in an area that has 4 seasons, okay, then expect for the first couple of weeks, okay, to feel a little bit more uncomfortable, okay, but do the things I suggest for you, and that'll minimize these until your body gets reacclimated to that season, okay, and then go to the next one, and so forth and so on. Gee, I hope I helped you understand a little bit about the weather changes, the seasonal changes. They are here. Sorry about that, folks, but they are here. Some of you are feeling it more so than others, all right? You can have dramatic weather changes. Don't be surprised, especially fibromyalgia patients. Oh, extreme heat, extreme cold are definitely a problem for fibromyalgia patients. But that includes anybody that has inflammatory conditions. So I hope you enjoyed this, and I hope that you'll be able to use this if you either stay home or if you're doing some traveling. But I'd like to bring this information out to people. Next time, we're going to be talking about something that is interesting because a lot of people contact me and say, well, how did you get started in this? You know, how did you get involved with fibromyalgia? So I'm going to do a little bit of a history of myself and the history of fibromyalgia. And then I'm also going to talk about the patient successes that we've had in our fibromyalgia program and protocol, which are many. And so we're very, very proud of that, and we're very excited. And we'll talk about that next Monday, 12:30 p.m., Fibromyalgia Wellness Center. Again, all of these are being saved now on YouTube, and so you can look back at them, at all the different subjects that we have covered and talked about. I want to thank each and every one of you for your time. Have a wonderful week, and be safe and happy and healthy, and look forward to seeing you next week. Thank you so very, very much.